An estimated 15,000 Guamanians, or close to 10% of the population, leave the island annually to pursue health care elsewhere. According to Guam Healthcare Development Inc.'s President and Chief Executive Officer, Margaret Bengzon, this means close to $60 million is leaving the island annually, too. Bengzon was well received by the Rotary Club of Tumon Bay earlier this afternoon, where she spoke on the Guam Regional Medical City, the new hospital slated to open in 2014. Bengzon says Guam has a 1.3% growth rate, outpacing both the national and world average. Guam also outpaces the United States in other areas, including heart disease, liver disease, cancer mortality, and diabetes. In the U.S., diabetes affects 8% of the population. In Guam, it affects 1 out of 4 people.
That's the demand side, large and growing. The supply side, we have the opposite situation. We have a situation where there are deficiencies, there are gaps. Between Guam Memorial Hospital and the Naval Hospital, we have just about 200 beds.
According to World Health Organization, or WHO standards, the island needs another 160 beds to cater to the population. It's not just beds we're short on, but fundamental equipment is limited or unavailable on the island. Bengzon concludes that the island is in dire need of another hospital and assured today's Rotarians that the regional medical city could do that and more. Already 80% of the foundation is complete at the Dededo site. The first of 2 tower cranes has arrived, and in the coming weeks, motorists will see the superstructure go up. The new hospital will be 270,000 square feet and provide 130 beds with room to grow up to a capacity of 250 beds. The project comes in at a price tag just under $220 million.
Very robust emergency facilities, surgery facilities, intensive care delivery facilities, and most important, availability of services needed in Guam. Cardiology, oncology, endocrinology, pulmonology, rheumatology, and so on.
Bengzon says the new hospital will stimulate the island's economy, attracting not only businesses and tourists, but a silver market. Guam is already in a position to become a retirement destination, but Bengzon says retirees want to be assured that if they get sick, they can be cared for.
With the Guam Regional Medical City, Guam is now positioned to attract very good, very strong businesses and industry. So we can think about the hospital as both a magnet and an anchor, bringing in quality professionals, quality organizations, and keeping them here, anchoring them.
Reporting for Guam's News Network, I'm Crystal Paco.